Hello, you're welcome to my platform. I am Dr.Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about rabies. Rabies is a deadly condition that is caused by a virus called the rabies virus, and it usually affects the central nervous system, that is the brain and the spinal cord. It is a deadly condition because it is incurable. There is no known medication that actually cures rabies, especially when the symptoms have set in. However, it is a preventable condition. Rabies primarily affects animals, for example, the domestic animals and the wild animals. The examples of the domestic animals that are commonly affected by rabies include the dogs. Rabies can as well affect the cats, the horses, the donkeys, the sheep, the pigs, and the camel. It can also affect wild animals, for example, the bats, the buffaloes, the elephants, the monkeys, the foxes, the raccoons, and majority of the wild animals. 99% cases of rabies are due to scratches and bites from domestic dogs. It can be transmitted from these animals to human beings, for example, through a bite. If the human being has been bitten by one of these animals, it can also be transmitted when that individual initially had a wound and one of these animals licked that wound and introduced saliva into the injured skin or mucous membrane. Rabies can also be transmitted through inhalation, that is breathing in of the rabies virus. Rabies can also be transmitted from one person to another through a bite. For example, if a healthy individual was bitten by an individual that was infected by the rabies virus, it can also be transmitted if the infected individual donated some of their organs to the healthy individual. Once the rabies virus gets into the body, it escapes being eliminated by the cells of the immune system through a variety of ways. The immune system, by the way, is the system within our body that is responsible for protecting us from invading germs. In our context, the rabies virus. One of the ways that the rabies virus escapes being eliminated by the cells of the immune system is through the sabotaging of the production of some chemicals called the interferons. The interferons are responsible for alerting the cells of the immune system to come and eliminate the rabies virus once it is in the body. The interferons are also responsible for activating the cells of the immune system such that they are able to eliminate the rabies virus. So once their production has been sabotaged, the virus goes untouched. It is not eliminated from the body. Another way that the rabies virus escapes being eliminated by the cells of the immune system is through killing of the cells of the immune system called the T lymphocytes. The T lymphocytes, by the way, are one of the cells of the immune system that play a role in the elimination of the rabies virus. And once they are killed, they cannot eliminate the rabies virus. So the rabies virus kills them before they eliminate the rabies virus. Now that the rabies virus cannot be eliminated by the cells of the immune system, it will just continue to multiply in the tissues where it has been inoculated, where it has been introduced into the body, for example, via a bite or a scratch. The rabies viruses will now move along the peripheral nerves and they will travel to the central nervous system, that is the brain and the spinal cord. The peripheral nerves, by the way, are a network of cells within your body that are responsible for picking up information on your body. For example, sensory information like touch, if something touches your body, or if you feel pain in a given part of your body, or for example you have been hurt, or maybe you're feeling hot or cold in a given part of the body. For example, something is burning your leg. So it is now these peripheral nerves, these cells that pick up that information and they take it to your central nervous system, the brain and the spinal cord. Now the brain has to send command to the body, and this command is still sent through these peripheral nerves, such that when the command reaches the body through the peripheral nerves, the body responds, for example, by contraction of your muscles of the leg, if the leg was being burnt, such that you get the leg away from danger, from whatever is burning you. Once the rabies viruses get into the central nervous system, especially the brain, they are safeguarded, or they are protected by what we call the blood-brain barrier, such that the cells of the immune system and the antibodies cannot access it, so they cannot still eliminate it when it gets to the brain. The blood-brain barrier, by the way, is like the gatekeeper of the brain. It prevents bad things from coming to the brain, and it allows good things that the brain needs to come into the brain, for example, oxygen and nutrients. Once the rabies virus has reached the central nervous system, that is the brain and the spinal cord, they multiply in large numbers, and this results to the destruction of the cells of the brain and the spinal cord, the neurons. In the brain, it will result to a condition called encephalitis, that is the inflammation, irritation of the brain. While in the spinal cord, it will result into a condition called myelitis, that is the inflammation, irritation of the spinal cord. After causing all that damage to the central nervous system, that is the brain and the spinal cord, the rabies viruses will now travel to other parts of the body. For example, the organs of the body, that is the salivary glands, the heart, the muscles, the adrenal glands, and the skin. In summary, the rabies viruses travel from the tissues of the bite injury or the scratch injury to the peripheral nerves, to the central nervous system, and after that, it is transported to the organs of the body, for example, the salivary glands, the heart, the adrenal glands, the muscles, and the skin. During this course of travel of the rabies viruses that I've just laid out, the affected individuals will undergo a series of phases. These phases include the incubation phase. The second one is the prodromal phase. The third one is the acute neurological phase, and finally, coma and death. The incubation period, that is the duration from when the virus was introduced into the body, for example, via a bite, to the onset of symptoms, is usually 3 weeks to 6 weeks. But in rare cases, it can be longer. It can even take years. During the incubation period, the virus is within the body, but it has not got to the central nervous system, that is the brain and the spinal cord. At this moment, the individual that was bitten by the rabid dog does not have any signs and symptoms yet. Therefore, if treatment is instituted at this moment, the individual will not end up with rabies. Now, let's talk about these phases in details. The first phase is the incubation phase. The incubation phase is the duration between when the virus was introduced into the body, for example, via a bite, to the onset of symptoms. And in rabies, it is usually between 3 weeks to 6 weeks. But in rare cases, it can even be years. So the individual will take years before they even get the signs and symptoms of rabies. The second phase is the prodromal phase. The prodromal phase usually lasts about 10 days. During the prodromal phase, the rabies viruses travel through the peripheral nerves and they head to the brain and the spinal cord. And as they travel through the peripheral nerves, they also cause damage to the peripheral nerves. During this period, the immune system tries to fight off the rabies virus, and usually the affected individuals will present with flu-like symptoms. The moment the patient reaches the prodromal phase, they cannot be cured of rabies. During the prodromal phase, the signs and symptoms include fever, fatigue. There will also be pain, tingling sensation, and numbness at the point where the patient was bitten. And this is usually because of the nerve damage in that area. There will also be burning and itching at the area where the patient was bitten. The affected individuals can also present with cough, a sore throat, nausea, vomiting, and diarrhea. The third phase is the acute neurological phase. During the acute neurological phase, the rabies virus starts to damage the central nervous system, that is the brain and the spinal cord. There are two forms of the acute neurological phase, meaning the patient can either present with one or the other. The first one is the furious rabies, and the second form is the paralytic rabies. About 2/3 of the rabies victims present with the furious form of the acute neurological phase. The other 1/3 will present with the paralytic form of acute neurological phase. The individuals that will present with the furious form of the acute neurological phase will present with signs and symptoms of aggression, agitation, delirium, seizures, hallucinations, muscle twitchings or spasms, hyperventilation, that is fast breathing, tachycardia, that is a racing heart, the heart rate will be increased, fevers, excessive salivation, and facial paralysis. The affected individuals might also present with anisocoria. Anisocoria is when the pupils are of different sizes. For example, one might be bigger in size and the other one might be normal or smaller in size. 50% of the patients that will present with the furious form of the acute neurological phase will also present with hydrophobia and aerophobia. Hydrophobia, by the way, is the fear of drinking water, while aerophobia is the fear of air being blown into your face. The individuals that will present with the paralytic form of the acute neurological phase of rabies will present with the following signs and symptoms: weakness and paralysis. The weakness and paralysis will usually start from the bite injury or the site where the individual was bitten by the rabid dog, and they will progress to the rest of the body. There will also be fever, headaches, and neck stiffness. The last phase of rabies is coma. That is, the patients will lose consciousness. They will become unresponsive. Unfortunately, at this point, the patients die eventually. Actually, rabies is 100% fatal. All the individuals that have been bitten by the rabid dog and they get the signs and symptoms eventually die. The individuals that are commonly affected by rabies include children, especially those less than 15 years of age, although other individuals of other age groups can be affected. Individuals that live or travel to areas where rabies is common in dogs, for example, Africa and Asia. Veterinary students, veterinary doctors, individuals that live around bats. By the way, bats can also carry rabies. especially those individuals that love going in caves, touring in caves. Laboratory technicians, especially those that handle samples that have the rabies virus. And lastly, the animal handlers. When it comes to the diagnosis of rabies, unlike other conditions where we base on the signs and symptoms to diagnose a patient with a given condition, please don't wait for the signs and symptoms of rabies to set in. The moment you get bitten or scratched by any animal, please come to the hospital immediately. This is because once the signs and symptoms of rabies set in, you cannot be cured of rabies. So it is very, very important that you show up to the hospital immediately you get bitten or scratched by any animal. For example, dogs, cats, birds, cows, or any other animal. The investigations that we carry out in rabies include a culture, and this one can be done on saliva or the cerebrospinal fluid. We can also use PCR, and here we also use saliva and the cerebrospinal fluid. We can also employ the immunofluorescent antibody staining, and this is usually done on a skin biopsy that is usually obtained from the back of the neck. It usually looks out for the antibodies against the rabies virus. And lastly, we can do MRI of the brain. When it comes to the management of rabies, there is no single medication that is known to cure rabies. Once the signs and symptoms of rabies set in, the individuals usually die. However, we can employ the post-exposure prophylaxis, and this is usually employed before the signs and symptoms set in. The post-exposure prophylaxis entails 3 parameters, and these include wound care, the rabies vaccine, and the anti-rabies serum. Once you get bitten or scratched by any animal, please come to the hospital such that you get the post-exposure prophylaxis. It is the only thing that will protect you from getting rabies, because once the signs and symptoms of rabies set in, you cannot be cured of rabies. Unfortunately, you will die. During the wound care aspect of the post-exposure prophylaxis, the wound is washed with running water, and this is usually done for at least 15 minutes. Washing the bite wound or the scratch wound with running water reduces the viral load of the rabies virus. The amount of the rabies virus within the wound reduces, and this reduces the chances of getting rabies by 80%. The water we use for washing the bite or scratch wounds can be warm plain water or warm soapy water. After washing the wound with water, we can now employ the virucidal agents. These include povidone iodine or alcohol. The wound should be left open, it shouldn't be closed with sutures. Please also avoid scrubbing the wound. You only need to just pour the water into the wound. Please avoid touching the wound with your bare hands. Always use gloves when touching the wound. The second aspect of the post-exposure prophylaxis is the anti-rabies serum, and this is usually injected into the wounds. We can either use the horse anti-rabies serum or the human rabies immunoglobulin. But when you're using the horse anti-rabies serum, please always use a test dose first. This is because these patients tend to get an adverse reaction to the horse anti-rabies serum. The third aspect of the post-exposure prophylaxis is the rabies vaccine. There are different types of the rabies vaccine that we use, and these include the nervous tissue vaccine, the avian vaccines, for example, the duck embryo vaccine, the cell culture vaccine, and the human diploid cell vaccine. The rabies vaccine is given to all individuals that have been exposed to the rabies virus, and these include individuals that have been bitten, scratched, or whose wounds have been licked by any of the animals that I laid out earlier. It is also given to all individuals that have been bitten by rabid animals. If the animal dies within 10 days of observation, by the way, whenever an animal bites any individual, it should be caged somewhere and observed if it dies or if it survives. So if it dies within 10 days of observation, the individual has to be given the rabies vaccine. It is also given in individuals that were bitten by an unidentified animal. If the laboratory tests for the animal shows positive for rabies, and all individuals that have been bitten by wild animals should receive the rabies vaccine. Now, let's talk about the latest World Health Organization recommendation for the rabies vaccine. These were formulated in 2022. The 2022 WHO recommendations suggest that we transition to a shortened 1-week vaccination schedule for the rabies vaccine. According to this new schedule, the exposed individual receives the rabies vaccine on day 0, day 3, and day 7. So they only require 3 visits to the facility. On each of the visits, the individual is injected with 0.1 mL of the rabies vaccine on 2 sides of the body. For example, the upper arm of both sides, and it is usually given intradermally in the second part of the skin, the dermis. To ensure that the rabies vaccine is injected in the dermis, the second part of the skin, we employ the insulin syringe. Day 0, by the way, is the day of the first vaccination, the day the individual is able to access the vaccine. It is not the day of the bite or the day of the exposure to the rabies virus. When it comes to the prevention of rabies, the following can be employed. We can employ the pre-exposure prophylaxis vaccine, PrEP. This is given to individuals that are at a higher risk of getting rabies. For example, veterinary students, veterinary doctors, animal handlers, laboratory technicians, especially those that handle samples that have the rabies virus, individuals that are exposed to bats, especially those individuals that love touring in caves where bats reside. During the pre-exposure prophylaxis vaccination, we employ 1 ml of the cell culture vaccine and we inject it IM, intramuscular, in the muscle, or we can employ 0.1 ml and we can inject it intradermally in the dermis, the second part of the skin. We give the vaccine on day 0, day 7, and day 28. After 1 month, the serum titers for the antibodies are assessed. If the serum antibody titers are less than 0.5 international units per ml, 1 booster dose is injected. After that, subsequent booster doses are given once after 2 years. Please keep your domestic pets safe. Don't allow them to interact with stray animals, for example, stray dogs and stray cats. Please avoid contact with wild animals because they have the rabies virus. If you ever get exposed via a bite, a scratch by any of the animals, please make sure that you come to the hospital for a post-exposure prophylaxis vaccine. This will help you to not acquire rabies. Please do this before you get the signs and symptoms of rabies, because once the signs and symptoms set in, rabies cannot be cured. Please also make sure that the vaccination of your pets is up to date. Please don't let your pets roam free without any supervision, because they can easily interact with stray animals, and these stray animals majority of the time are infected with the rabies virus. If you ever find a bat in a room where someone is sleeping, just assume they have been bitten. This is because the bites from bats are really very small, so they can go unnoticed. Let them be vaccinated. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.